3 of the 5 medications I am about to share with you require no prescription. You can walk into any pharmacy right now and buy them off the shelf. That is exactly what makes them so dangerous for anyone over 60. Because when something is easy to get, we stop treating it like a drug. We treat it like it is harmless. And for a body that has crossed the threshold of 60, that assumption can lead to serious consequences. Here is something most doctors do not explain clearly enough during a 15-minute appointment. The human body processes medications in a fundamentally different way after 60. Your kidneys filter drugs out of your bloodstream more slowly. Your liver metabolizes compounds at a fraction of the rate it managed 20 years ago. Your brain becomes more sensitive to sedatives and certain chemical compounds. A dose that was safe for you at 45 can now cause falls, memory impairment, kidney damage, and cognitive decline. Today I am covering 5 specific medications that illustrate this problem more clearly than any others. All 5 appear on the American Geriatric Society Beers criteria. This is the medically reviewed, regularly updated list of drugs considered potentially inappropriate for older adults. This is not fringe medicine. It is mainstream geriatrics finally reaching the people who need it most. I am Dr. Stephen Clark, and this channel is dedicated to translating current research into practical information. We focus specifically on actionable guidance for adults over 60. If you have not subscribed yet, please do. We publish new evidence-based content every week designed specifically for you. Now let us get into these 5 medications and more importantly what to do if you are taking any of them. The first category is benzodiazepines. You probably recognize the brand names more than the drug class. Xanax, Valium, Ativan, Klonopin. These are prescribed primarily for anxiety and insomnia. They do work in the short term. That effectiveness is part of why they are so widely used. And it is also part of why they are so consistently problematic for older adults. After 60, the brain sensitivity to benzodiazepines changes significantly. Because the liver metabolizes these drugs more slowly, they accumulate in the body. A dose meant to help you sleep at PM may still be impairing your coordination at AM. That is when you get up for a glass of water and a fall becomes a real danger. Multiple systematic reviews confirm that benzodiazepine use is associated with a substantially increased risk of serious falls. These are falls serious enough to require hospitalization in older adults. Falls are the leading cause of fatal injury in adults over 65 in the United States. We are not talking about a minor side effect beyond the fall risk. Benzodiazepines consistently impair memory, attention, and executive function in older adults. This happens even when people feel they have fully adapted to the medication. The American Geriatric Society explicitly lists the entire benzodiazepine class on the Beers criteria. They are listed as drugs to avoid in older people. If you are currently prescribed Xanax, Ativan, or Valium, please do not stop taking it suddenly. Abrupt discontinuation can cause serious withdrawal effects. This is a conversation to have with your doctor about a supervised gradual taper. I will tell you exactly what to bring to that appointment in a few minutes. Comment below right now. Are you or someone in your family currently taking any of the medications I have mentioned or will mention? Comment on the list. I want to see how widespread this actually is. The second medication on this list genuinely shocks people because it costs $6 at any drugstore. Diphenhydramine, sold as Benadryl for allergies. It is also the active sleep ingredient in Zquil, Unisom, and Tylenol PM. Millions of adults over 60 take this every single night believing it is completely safe. They are confident that if it is available without a prescription, it must be harmless. It is not safe. Not after 60. Diphenhydramine is one of the most potent anticholinergic drugs available over the counter. Anticholinergic means it blocks acetylcholine, the primary neurotransmitter your brain uses for memory and learning. Interfere with that chemical nightly for months or years and the consequences are serious. A landmark study published in JAMA Internal Medicine in 2015 followed over 3,400 adults aged 65 and older. Researchers tracked them for over 7 years and found a clear dose-response relationship. The relationship was between cumulative anticholinergic drug use and dementia risk. Those in the highest use category had a 54% increased risk of developing dementia compared to non-users. The most common anticholinergic drugs in that study were first-generation antihistamines exactly like diphenhydramine. A 2019 study in JAMA Internal Medicine looking at nearly 60,000 dementia patients confirmed those findings. The evidence has continued to build every single year since, Eleanor was 71 years old and had been taking to Benadryl tablets every night for nearly 5 years. Her doctor had actually suggested it for sleep. Over those years, her family watched her become increasingly forgetful. Repeated questions, confusion in familiar places, and lost words mid-sentence. A new geriatrician reviewed her medication list and flagged the diphenhydramine immediately. Over the following 7 months after she stopped taking it under medical guidance, her cognitive scores improved. Her daughter said it felt like getting a piece of her mother back. The change was truly noticeable. The next medication is one that tens of millions of adults over 60 reach for when their knees or back flare. The kidney damage it causes develops silently without a single symptom. By the time most people realize something is wrong, the damage is already advanced. Stay with me because this one is in almost every medicine cabinet. In America, the third medication is ibuprofen and naproxen, sold as Advil, Motrin, and Aleve. These non-steroid anti-inflammatory drugs are the first response to pain in most households. For occasional use in younger adults, they are generally manageable. For regular use in adults over 60, the risk profile changes entirely. Your kidneys are responsible for filtering these drugs from your bloodstream. After 60, kidney function has typically declined compared to young adulthood. When ibuprofen circulates in a body with already reduced kidney function, it lingers much longer. It hits much harder and progressively damages the very tissue responsible for clearing it. The 2023 update to the American Geriatric Society bears criteria reinforce the need for kidney function-based dose adjustments. This specifically applies to these medications in older adults. The criteria recognizes how frequently this class causes acute kidney injury in adults over 60. This is not a rare or unusual complication. It is well documented and consistent. The gastrointestinal risk is equally serious. The stomach lining becomes more fragile. With age, and these medications directly impair its protective barrier. According to the NIH, older adults who use these medications regularly are 3 to 5 times more likely to develop a serious bleed, and those bleeds are far more dangerous in someone over 60. For anyone with heart disease or high blood pressure, these medications raise blood pressure further. They also increase fluid retention and elevate strain on the heart. This combination makes ibuprofen and naproxen particularly dangerous as a daily or near-daily habit after 60. Tell me in the comments, do you currently use ibuprofen or naproxen for pain? Yes or no? I am going to tell you what works better for joint pain in adults over 60 without any of these risks. That is coming up shortly, so stay with me. The fourth medication is prescribed to roughly 10 million Americans annually for sleep. Zolpidem, sold as Ambien. The FDA issued a specific safety communication about this drug and older adults. It noted that patients over 60 can have far higher blood concentrations of Zolpidem the morning after taking it. This is compared to younger users taking the exact same dose. This means they are still affected when they wake up, without even knowing it. They feel like themselves and they do not feel sedated, but their coordination and reaction time are seriously compromised. Research consistently finds that Zolpidem use is associated with nearly twice the risk of hip fracture in older adults. Hip fractures in adults over 60 carry serious and life-altering consequences. There is an additional problem that most people are never told about. Zolpidem suppresses the deep restorative stages of sleep while increasing lighter sleep stages. So you fall asleep faster, but you wake up less restored. This drives continued use, higher doses, and dependency over time. It solves nothing in the long term. It simply changes the shape of the problem while creating new ones. The fifth medication surprises more people than any other on this list. Proton pump inhibitors, omeprazole, Prilosec, Nexium, Prevacid. These are among the most widely prescribed drugs in the entire world. For short-term use of 4 to 8 weeks, they are appropriate and effective for acid reflux. The problem is that most adults over 60 are not taking them for 8 weeks. They have been on them for years, sometimes decades, without any reassessment, long-term. Use after 60 quietly depletes 2 critical nutrients your body depends on. First, vitamin B12. Your stomach acid is essential for absorbing B12 from food. Suppress that acid for years and B12 absorption drops sharply. Research published in JAMA found that long-term use was associated with a 65% higher risk of B12 deficiency. In older adults, severe B12 deficiency causes tingling and numbness in the hands and feet. It also causes cognitive decline that can closely resemble memory loss or early dementia. Many people and their families never connect these symptoms back to a medication. Second, magnesium. The FDA issued a specific safety communication warning about dangerously low magnesium in long-term users. Low magnesium affects heart rhythm and nerve signaling in serious ways. This compounds other cardiac and neurological risks already present in older adults. Robert was 76 and had been on omeprazole for 9 years. It was originally prescribed for a concern that had fully resolved long before. He had been living with severe foot numbness and what his family called a mental fog he could not shake. His B12 came back critically low. His doctor tapered him off the medication over 8 weeks and started B12 replacement therapy. He also shifted Robert to dietary changes and a safer alternative for managing reflux. 4 months later, the neurological symptoms were clearly and noticeably improving. 9 years of an unnecessary prescription caught with just one thorough medication review. Here is exactly what to do after watching this video. First, write down every medication you take, both prescription and over-the-counter. Yes, include the Benadryl, the Advil, and the Prilosec. Over-the-counter does not mean safe for everyone at every age. Second, bring that list to your doctor and ask specifically for a geriatric medication review. Request an evaluation against the American Geriatric Society Beers criteria. Those exact words will be immediately recognized by any informed medical professional. This one step alone could change your health trajectory significantly. Third, for pain, ask your doctor about acetaminophen as a first-line alternative. It is significantly safer for kidneys and the digestive tract in adults over 60. The correct dose is no more than 3,000 milligrams total per day for adults over 65. Always confirm the right amount with your personal doctor. Fourth, for sleep, ask for a referral to cognitive behavioral therapy for insomnia, known as CTI. Studies consistently show it outperforms every sleep medication for long-term outcomes. It comes with 0 drug interactions, 0 dependency, and no morning impairment. This is the approach the research strongly supports for older adults. Fifth, if you have been on a proton pump inhibitor for more than 6 months, ask your doctor 2 questions. Ask whether you still need it and whether your B12 level has been checked recently. These are simple questions that could prevent serious long-term complications. One conversation with your doctor could make a significant difference. A critical safety note before we close. Do not stop any prescription medication without speaking to your doctor first. Stopping certain medications without medical supervision can cause serious withdrawal effects. Any medication change requires careful, coordinated medical oversight. These 5 medications are not automatically problematic for every person in every situation, but in adults over 60, used long-term without reassessment, the research is consistent. Your body has changed since you first started taking some of these drugs. Your medication list may need to catch up with those changes. Leave a comment below with one of 3 things. Comment reviewing my list if you are going to check your medications today. Comment your age and which of these 5 you want to ask your doctor about. Or comment sharing this if you are sending it to someone who needs to see it. Please subscribe because next week I am covering 5 supplement combinations that are quietly concerning for older adults. This includes combinations being sold together in the same bottle as if they are perfectly safe. That video could genuinely protect someone you love. I am Dr. Stephen Clark, and I will see you in the next one.